to listen to you.
Thank you so much, Dr. Uma, and it's a real pleasure to be with you today. Let me also share some slides maybe to walk you through what we are doing. In fact, the Novartis Foundation is really, as you said, Dr. Uma, working on how we can advance data and AI-driven approaches to improve population health at large in the world. So in fact, our work is focusing on low-income populations wherever they live, and until now, mainly in low and middle-income settings. But why do we do that? Because the challenge of global health nowadays is really unprecedented. As you all know, the COVID crisis is just a wake-up call that our health systems are not really prepared to address all the burdens we are facing, and specifically not in low and middle-income settings, where there's a real huge tide of a triple burden across the world now, with rising obesity and the rising numbers of chronic diseases, besides the acute diseases and infectious diseases that are still there as well. Rapid urbanization is huge, specifically in low and middle income settings, and it's compromising the existing infrastructure for health and care delivery. So not only these risks of constantly emerging new diseases, but all these other things coupled to a massive shortage of health workers, skilled health professionals in the world, makes us realize that we need to do things differently. It calls for innovating health and care around the world. And I was very inspired by your speech, Julie, of everything that is already feasible and going on in the US with the use of data and AI. It's really inspiring. But let me tell you that there's a lot of things going on with AI as well across low and middle income settings. So this is our mission at the foundation. We advance data and digital-led approaches towards population health to help systems in country transform themselves from being these reactive systems waiting to see people getting sick before they care for them, to become proactive, predictive, and even preventative, so that they can keep their populations healthy. The building blocks of our work are, on the one hand, our urban cardiovascular population health approaches on the ground, where we have a main urban health initiatives across Latin America, Africa, Asia, and now starting also in the US. Another building block of all of our work is the Global Data Collaborative on Cardiovascular Population Health that we have been setting up together with Microsoft and Accenture, and where we are now partnering with the World Heart Federation to make it one big global hub of cardiovascular data that we can use to help policymakers make better decisions on their allocations or on other topics in health. And lastly, we work on catalyzing new policies for AI integration in health. And that work we do through our work with the Broadband Commission for Sustainable Development and through our dialogues that we organize between cities. AI for Healthy Cities is an exchange platform where cities in high income settings that have massively successful examples of how AI can transform health and well-being in their population with cities who don't have so much experience yet. For example, the dialogue that is now happening is between Montreal, which is probably the gold standard of how you can use AI in urban planning for improving the health of the population, with São Paulo in Brazil, where we have been running our cardiovascular population health approach with the state government and the city authorities since quite some years. So these building blocks, then coupled to our multi-sector partnerships we have set up in the different areas in the world, help us to achieve our goal. And let me give you just one word about this Global Data Collaborative for Cardiovascular Population Health, because I feel it may become a real important tool for policymakers in the world, regardless where they are, really do this thing to re-engineer their health and care systems into these proactive, predictive, and preventative systems. It is feasible, but you need to do it with the right data and use real-time data in an ethical way, as you so rightly underlined, Juby. I very much appreciate that point. You have to do that to really then build those policy guidances or influences that can have the biggest impact on the largest number of people. So this is not a data collaborative that will look at cardiovascular medicine or medical care, because there's many data collaboratives like that around the world. This one specifically will help policymakers. How can we allocate our scarce resources best, or how can we target those populations who need most our interventions? Because we see there's a lot of waste in the system. I don't have to tell you, I'm sure, of how resources are managed in a general way without having those insights from the real-time data. So that's the goal of the data collaborative. Now, our work with the Broadband Commission for Sustainable Development, I'm not sure if you know that organization, but the Broadband Commission exists since a little more than 10 years. It is an organization co-chaired by ITU and UNESCO, and brings together all the big tech players, telecommunications players, with the CEOs of Microsoft, Google, Amazon, everyone in that Broadband Commission, coupled with the public sector leaders in the field of telecommunication and digital innovation and AI innovation now, with some other private sector players. So it's a huge organization, and in there, we are the only health voice currently, with luckily this year we have the World Health Organization also joining the Broadband Commission. So we have been chairing the working group on health specifically there since now 5 years. The first one looked at how national governments can really tap into the potential of digital to transform their health systems in more efficient health systems. And that report came out in 2015 or 16, I believe, a long time ago, but it really stressed that what you need first and foremost in a country to do so is political vision, that digital is important for your health system, and then commit to sustained financing for it. You need intergovernmental and intersectoral collaboration between IT, health, finance, all of these different sectors. Otherwise, it won't get off the ground in national digital health strategies. And you need a framework for national regulatory standards, legal standards, and interoperability standards to be able to tap into the potential of digital. The second working group specifically looked at how digital transformed the way we can address the needs of chronic patients with non-communicable diseases, as they are very much left behind in many low and middle income settings where health systems are only geared towards acute care. And the last working group now that came out with our recommendations last year in 2020 was focusing on how AI is already making a tremendous impact in the world on health and care, but also on how governments can really advance in their maturity to deploy AI solutions in their health systems. So we looked at a landscape analysis of about 300 use cases of AI across the world, and distilled the insights from that landscape analysis to then build that roadmap towards AI maturity in health. All of the experts and members of the Broadband Commission who participated in this working group are here on the screen. So you see that all the big UN players, but also a lot of big private sector players are in the game here. And we have worked together to build this very solid recommendation for maturity, for advancing in your maturity to deploy AI in the health and care systems. So we distilled the landscape analysis and we found 5 main use cases. You've probably heard about that already, but the main use cases were not only focusing on clinical care, as you can see, clinical care is very important. The use of AI there, specifically what is most advanced, as you also highlighted, Juby, in image-based diagnostics that is much faster and more accurate thanks to artificial intelligence now, but also in many other settings, like, for example, Apollo Hospitals in India, one of your major healthcare providers in India, has developed with its millions of data on cardiovascular disease, for example, has developed a new cardiovascular risk score that first started with 300 indicators, distilled it down to 40 indicators, and now is using 7 very simple indicators that don't even require an investigation with a blood analysis, but 7 simple indicators can predict if a person will do a heart infarction 5 to 7 years later. And that risk score far outperforms the good old Framingham risk score that we know from all the long-term follow-up studies in Framingham from the 50s and the 60s. So Apollo's risk score is now going to be, is already validated in a data set with the Netherlands government. It's now going to be validated in our data in Brazil, for example, because it is simple and scalable in a massively important way. But all the other use cases are as important. We've seen how AI has helped. In the beginning, AI was the factor that made AI discovered. This unusual cluster of pneumonias in Wuhan was detected by Blue Dot, an AI-driven screening. So population health and the prediction of epidemics was already being done a lot with AI, like with the examples of Magic Box from UNICEF, for example. Preclinical research and development of new drugs has been massively advanced and simplified with the use of AI. We've seen that drug discovery is advanced much by using it. What kind of drug we already have on the market, can we repurpose them for certain clinical pathways? Because AI has discovered new pathways in different diseases. Benevolent AI here is an example of how in the beginning of the COVID epidemic, they were able to scan all the drugs on the market already and find which ones would potentially have an impact on COVID. And they discovered that one of the rheumatoid arthritis drugs was massively active on COVID as well. Other examples of patient-facing solutions, one very important one is the Chinese Ping An Good Doctor. Ping An is a great health insurance, or a large health insurance company in China, which has developed 24/7 services online with internet, hospitals, internet, health centers, internet pharmacies, delivering with the goal to deliver access to a doctor to every family in China, access to a health plan to every family in China, and access to a health record. So Ping An Good Doctor already is doing more than 1 billion consultations per day. So if you can imagine, that kind of a setup has been revolutionized in the way we deliver health and care now, if you look at that example in China. And lastly, AI is massively influential to optimize how our health and care systems function, in fact. You can not only automate supply chains or your human resource capacity planning, you can also automate the detection of a cardiac arrest by someone who is calling a call center. So Corti is an example of how the AI model uses voice recognition to recognize that the person who's calling has a cardiac arrest. And it's much faster than the responder to the call can recognize it. So, and we know that every second counts in the recognition of a cardiac arrest. So these examples of innovations were really important in the world and are having a massive impact already. So I told you about Apollo risk score, the Ping An Good Doctor example. And based on all of these insights, we then distilled that into a roadmap for a country where they should invest in if they want to become more ready to deploy AI throughout their health systems. And interesting enough, it's not only about investing in data and technology. It is obviously one of the main pillars, but it's not the first and foremost important one. The most important one is that governments invest in their people capacities and in their workforce capacity, because we see that increasing digital skills throughout the workforce and in the educational system, integrating it from the start will really help us to transform health systems. If that doesn't happen, there's going to be a massive gap in skills for deploying such solutions in health systems. So that's the main important factor governments have to invest in now, not to be left behind, because low and middle income settings have most to gain from the innovations we have in our hands now, but they can be losing a lot if they don't use that and they don't invest in the right domain areas at the moment. The second one is obviously the data we need and the technology. You need the infrastructure, you need quality data. I'm not going to dwell on this because all of the other speakers before us have massively underlined that importance as well. You need really good, strong governance and regulatory systems to keep the people safe and to manage data privacy, obviously. And then a fourth investment area that is crucial for being successful in deploying AI in your health system is that the design of AI solutions has to be needs driven. It doesn't work with coming with a well-intended solution to a government and offering it. It has to be coming from the needs assessment first. So any design, any AI solution has to be designed on a needs basis and has to be human-centered. So the innovators have to take into account who will use the innovation when they design it. Otherwise, it will fail. We've seen it massively in many examples across the world where it fails because there was no thought up front by the innovator of what kind of processes you need to think about when you will have the solution to integrate it in the system so that it helps and augments the capacities of the human resources working in those systems instead of being an extra burden for them. We've seen too many examples of where digital technology has become more of a burden to the professional who's losing time on looking at his screen in the computer to introduce all the data they have to introduce instead of having time with the patients. AI can definitely give time back to health professionals with their patients and help them focus on what they are best at, taking care of people, instead of having taken care of the software and everything. So that's crucially important to invest in for any health system that wants to start deploying these innovations. Putting the right partners and stakeholders around the table, obviously, also in alignment. The government has to take the coordination role, because if a country is facing massive numbers of innovations in its health system, it cannot really coordinate or overview it anymore, and it will never be completely responding to the priority health needs of the government if of the country or the state or wherever you are looking at the population, because you need to work in this needs-driven way. If the partners that are bringing innovations have not been talking to each other, there's going to be a fragmented landscape, such as we've seen in many, many countries with digital technology in health. And that crucially is needed to be avoided. So the decision makers, whether that's the city government or whether that's the payer, which can be a private sector player, that's okay. It has to be those decision makers that are in the driver's seat to design or to allocate AI innovations to the needs they have. And then lastly, the governments have to be open for innovative business models to be able to make sure that we have incentives for innovators to work on the needs that governments or payers of system managers are expressing. There need to be this incentive for innovation. So that's something that has to be invested in as well. So this roadmap of 6 main pillars is a report that is available online. I can send you the link and you can look at it yourself with all the nice descriptions of all the case studies, but we are now translating that roadmap towards AI maturity in health into a self-assessment tool for any system manager, any decision maker on the ground to assess its own maturity. Because one country can be well advanced in the people and workforce area and have enough digitally and AI-driven skills in its population and workforce, but may not be ready with the necessary regulatory systems or may not have the right partners around the table. So you need to assess each single area or domain of this roadmap to be able to understand where you need to invest in a priority. So that self-assessment tool will be rolled out now in this coming months with several countries. We have been validating it with several countries already, and we are improving and optimizing it so that it can be really a self-assessment tool done by anyone who wants to assess its readiness to deploy AI solutions in health. So stay tuned for that tool. But let me end by saying that AI in health and care systems is really saving lives already. It strengthens health systems. It's not replacing health professionals per se. It's giving health professionals more tools in their hand to provide better quality of care, better long-term care, and deliver better health outcomes for their patients. And that's what every health professional wants. I know myself, because that's what you want as a health professional. I've gone a long way in my career, as you said, Uma. I started as an emergency physician, which I am trained for, in conflict areas around the world. And I was dropped in guerrilla areas in countries where there was conflicts going on since many years by plane, dropped by plane with my bicycle. And I was going on my bicycle from village to village where village health workers had been keeping patients who needed medical care for my attention. Obviously, I came too late in many cases. You can imagine me and my bike crossing the river and in the middle of nowhere. Nowadays, you can solve that by a simple phone call. So I'm the most passionate advocate for telehealth, if you may, and virtual care. If you have a simple phone call, is something we did 10 years ago in Ghana, I already demonstrate, you can really improve the quality of care from a village health worker. You can guide them through their patient care. And now AI with the robots, you were talking about Dubi. I think this is going to really revolutionize a lot for specifically the remote workers, but also for urban population health, because the needs are even higher there as people really have no access to the necessary care in these rapidly growing cities where there's absolutely a lack of infrastructure. AI in health has to become a real global and a national priority and become an integral part of every health system, not just a siloed approach towards improving health, but an integral part of the health system. It's just as essential as a hospital bed is, if you ask me. So let's work towards that. And the time to go for it is now, and we have no time to lose, really. Thank you so much. And I look forward to the rest of the discussion.
Thank you so much.